Hi, Dr. Vicky here. So let's talk today about neurological disorders, specifically Parkinson's, because I think I have two patients with active Parkinson's right now, and they couldn't be any more different in their presentation. So we have one that has tremors and one that does not have tremors. But we have a lot of neurological differences between the two. So there's different systems involved. And so when you have medications that are targeting a specific neurochemical dopamine, and there are neurological differences in their presentation, if you treat them the same, the results are not going to be very good. And so I want to talk about that first of all, because dopamine is the Parkinson's medication that a lot of Parkinson's patients take. And so one patient keeps upping their dose of the medication, and it's not getting any better. And that's the solution. PT has helped slightly, but not much. So we have so much that we can do to help these patients. And what I do is, number one, I have to look for deficiencies. What area of the brain is not working? Is it cerebellum, which is the balance center? Is it brainstem? So I've noticed, the hallmark of Parkinson's is loss of smell and taste. So that's the hallmark first symptom usually that they describe in the literature, that the first thing that happens. So that's a brainstem function. That is a temporal lobe function. So there's two different areas of the nervous system besides the midbrain where the dopamine is utilized. So we have all of these different things that will come into play here. So the other patient has extremely high tremors only on one side, though, which is atypical for Parkinson's. So if you have a patient that walks in and has both sides tremoring, that is a normal presentation. Forward bending is also normal, where they're hinged forward because they have balance. They feel like they're going backwards. So naturally, when you feel like your body is going backwards, you're going to lean forward. So there's instability in the spine and the muscles that support the spine. So that leads us to look at the cerebellum or the balance center. So those are things that are top of the mind for me when I'm talking about Parkinson's. I'm going to get into more detail about specific treatments for Parkinson's, because there's a ton of different things that you can do for that. So I'm Dr. Vicky. I'm with Sauter Chiropractic in Denver, Colorado, and I can be reached at 303-385-3432, and my website is sauterchiropractic.com. You can set up an appointment through my website. Hopefully talking to you soon.